Okay, we have some questions from the audience. We are going to go stepwise, so we'll cover all the topics. Okay. The first question is, how will the step one change to pass fail is going to affect the IMGs, and what is the importance of step two in this context?
Okay, thank you so much, Hamad and Murtaza, for having me. It's an honor to be at this forum. I'll tell you about the step two first.
Okay.
I have talked to many program directors, and this is what they think. The step two CS, first of all, is being removed. So that would be of minimum significance. So that's step two. Now, step one is going to become a pass fail.
Uh,
So they think that it is going to adversely affect IMGs. And I think this is not a surprise because as IMGs, we rely on very heavy scores in USMLE Step 1 so that we can be considered. So that is not out of the box. What now changes is the importance of Step 2 CK. Now, Step 2 CK would gain a lot more importance. Now, what I want to tell your viewers is that what happened first was that we took step one, we didn't do well in step one. Now we have step two to make it up. Now we don't have that liberty. Uh, the common notion is that just make sure you pass step one and then study very hard for step two. It is correct, but the only thing I would advise your viewers is that now they would not have a gauge of how good or how bad they were when they passed step one. So that is very important to know when they're preparing for step two. Now they have to be extra cautious because they don't have the guideline which they had previously.
okay.
Right, sir.
If anyone has questions, they can write in the chat box. We will take those questions as well. Okay, the next question is, if you don't match or you have low step scores, what measures you should take in order to augment your CV?
Okay. This is a very long answer, but if you did not match, you have to understand why you did not match. So you have to have a mentor or someone who you can talk to that can explain why you didn't match. It could be a very small reason, such as you didn't apply to the programs that you should have. You did not look at the program website to see if they were sponsoring visas. You did not look at the program website that they were not taking IMGs, or you did not look at their website to see that, oh, they have a threshold for step one or step two. So these are all easily fixable because you need to cater to the programs that want to hire you. Now, in terms of low scores, I tell the medical students that USMLE scores are the cake, and the electives, the observerships, the research is all icing on the cake. So you have to have a good cake to have a good icing on it. Regardless, I'll tell you my story. Unfortunately, I did not do well in step 2 CS. And I went there for electives. I did not do well in step 2 CS. Step 1 was 219, and then step 2 was 229. So my scores were okay, but I didn't do well in step 2 CS. Now, first thing you have to realize is that it's not the end of the road, but it's definitely very hard now. So in order to compensate, you need to, the best way to do it is, number one, I would recommend electives. Now, why do you do electives? It's not per se to get the US clinical experience, which you will be for anyways, but the best advantage of doing electives is you're going to be working with someone who has a say in residency. So you need people to support you who have a say in the program. So make sure if you are someone, even if you're a regular candidate with good scores, I strongly recommend that you choose places which have a reputation because their letters and their phone calls matter. The other thing you can do is research. Now, I do a lot of research. I work with students here also. And one thing is to get published. The best thing is the minimum thing you can do is to get published. The thing better than that you can do is to get published in a better journal like JAMA Surgery or Annals or uh, Lancet or New England, for example. I'm just saying. So better the journal, the better you will be heard. But the third most important thing is, again, the mentor that you are going to do the research with. How strong is his or her word in the world of residency? Do the program directors listen and respect Dr. Smith? And are they going to vouch for you? Because you need their phone call. If you have low scores, you need all the help possible. So I cannot emphasize enough how important your mentor would be to get you any help.
Okay, thank you. So you can ask the question now.
Sir, the next question, the most of the points we have already covered. So the next question is that you have mentioned that importance of clinical electives in augmenting your CV. So people ask a question that what is the ideal time to get LORs, or what is the ideal time we can do electives if we have graduated? We could go for observerships, and also that can we get hands-on experience after we are graduated? So please elaborate on this aspect as well.
One more
Okay.
thing here, how many LORs would we need? That's also
Yes.
people ask.
Okay, so I'll answer them one by one. Since I remember the last question, I'll just answer that one. How many LORs you need? You basically, the ERAS application allows you, I think I may be mistaken, 3 or 4 LORs. So you need those many. Okay. Now, Hamad, letter of recommendation is a different discussion. Who should write your letter of recommendation is also a different discussion. In general, it should be written by a US trained surgeon practicing in the US. That would be the easiest answer to go through. But what is written in your letter of recommendation is very, very important. If it says Mr. A was our student and he did a very good job, that is just an okay letter of recommendation. That attending may be writing it for many other. So there are some sign languages that attendings and consultants use in the letter recommendation to show how impressed they were with you. So we can talk about the wording of a letter recommendation. So in brief, who should you ask? You don't necessarily need to ask the chair of surgery or the division chief. I mean, their name is very important, but their letter recommendation may not be strong. Versus, for example, a junior attending who you have worked with, they're going to write a very good letter for you. So I would go with that one rather than the chair of surgery letter saying, yes, you were good. Because the letter recommendation need to say exactly how did you observe. I observed Hamad doing a laparoscopic cholecystectomy. I observed him taking care of this patient, and I was very impressed. It should give examples of the interaction, not just I had an interaction with him and he's amazing. Okay, so that's that. In terms of electives, they have to be done before you graduate. So I know many students would apply and they would do the electives, and that time would be covered because they have not gotten their degrees. So that's all okay. So you can get it before you have graduated. Now, how many electives you should do? I did 5 clinical electives, one of which I paid $3,000 to do one. And now that I'm talking to you, I recommend against doing a paid elective. Let me rephrase it. Doing an elective is much better than not doing one. Okay. But if you have 2-3 electives, you may not necessarily need to pay for another elective, and the amount is very high because the letter will again be, he's a good person and we recommend him. We need a very strong letter. So you should do those electives before you graduate. Electives is the only way to get a hands-on clinical experience. This elective is way more significant than doing an observership. But I have one caveat. The one caveat that is that if you're doing an observership, you may be doing with another physician who's very well known and very well respected. So now you see that you have built a bond. So from one angle, observership is not as good as an elective, but if you are going to do an observership with someone who can hold your hand and take you to the next level, that observership becomes very, very important. When should you ask for the letter recommendations? You should basically ask at the end of your rotation when you're finishing the elective. That is the best time for them to write. Then, because they remember you, and then just before ERAS, they can change the date so that you have a fresh letter recommendation. And I know many students waive the letter recommendation. A waived letter is better than an unwaived letter. But we can, if we have any doubts of the what is written in the letter recommendation, we can always choose to see what is in the letter recommendation. The difference won't be huge in a waived versus an unwaived letter. But it's very important where the letter of recommendation is coming from, what is written in the letter recommendation. If you even have one letter recommendation which shows that you have done a phenomenal job and that you should be hired as a physician, that you should take.
Okay.
Right, sir. Right.
Okay,
So,
now we
sir,
have a, yeah, let's ask it.
yeah. So we have a question from the audience as well, that regarding the COVID-19 situation of traveling. So is there what is the importance of virtual electives right now in this scenario? So do they have any importance, or if we could not get any live observership, so virtual electives are of any benefit?
Virtual electives can be of benefit. I think they are of benefit in fields where you basically can do a lot virtually, such as radiology. You don't need to be in a patient's room or with your physician. You can be at your home and you can look at images, right? Similarly, some fields of medicine where psychiatry, if you're interacting with a patient via Zoom and then they're going for your history and physical. So maybe they are good for those fields. Now, let me rephrase it again, that of course, something is better than nothing. So if you have to choose one, definitely go for it. I highly, however, doubt that an elective online would be of any benefit in fields such as surgery, which are hands-on, because for surgical specialties, you have to be in the operating room. So I would not recommend if you would do online electives for surgical specialties or specialties which include a lot of physical examination. Pathology may be a very good field to do online elective.
Okay, that's good. Those who are raising their hands can write their answer. We will do open QA at the end. Now we will just see your messages in the chat box. Okay, sir, now we have a question about a gap year. There are many students who start studying for these STEP exams after they complete their medical education in their university. So they don't do any clinical experience during the time they are only studying for the STEP exam. What is their what is their scope? How do gap years are going to affect them?
Yeah. So gap years are definitely very important. They keep an eye on gap years. Even when you're done with residency and doing fellowships or even attending jobs, the medical license would like to ask you, what were you doing from this time to this time? Because there is nothing in your CV to mention what you were doing. So gap years are not taken lightly. They are important and they have to be managed appropriately. What I usually recommend to students is that they should either do some research or some clinical observership, be it in your home country, or observe a doctor or go to a clinic 2 or 3 times a week, maybe, but do something that they can write in your CV that you are doing something. For example, right now, when I had a gap between changing my fellowship and my research, I started doing a little bit of more research. I started mentoring students. So you can do anything that you can write about in your CV.
Okay. What's asked?
Okay, I'll ask a question about research. That how an IMG can search for paid or unpaid research assistant jobs. As you know, that research is a great importance. So how can we search for these jobs?
Yeah. So my answer to that is, for the audience, is that there are, first of all, there are more research positions in some specialties than residency positions. So if it's a competitive field, it may be easier to find a research fellowship because they want the research fellow. So you have to look it from there, and also that many programs want to have a research fellow because their program will flourish with the research that you're going to do. How do you look for one? What you do is, things are easier right now in terms of the advent of social media. Everyone is on Twitter. The American websites are very updated. If you have an expert, like for example, if you want to research about, or if you want to be a surgeon, just go to Twitter and you'll find 20, 30 surgeons in no time. Then go to their institutional websites and then email them. The other way to do is that go to all the big hospitals, go state by state. First go to New York, then I'm going to do Massachusetts, then I'll look in Connecticut, whatever. Have a method and email them. I sent out mass emails, and I will promise you, you will only get 2 or 3 replies, but you need only one position. So you don't need 1,000 replies anyway. So what you need to do is you need to have a method to your madness. Either approach them via Twitter or through their websites, or institutional websites, and email them. Write a very good email, attach your CV. Now, please, I see this a lot. Do your homework before you're going to approach a doctor. If you know that the physician is a transplant surgeon, and yet you email them that I'm very interested in breast cancer research, then it looks very bad on you because you did not do your homework. So do your homework, see who you're going to email, have a nice templated email, change it as you like, but it should be definitely accurate, and you should know who your audience is. So appropriate address to the attending physician is very important when you're writing those emails. And then talk to your seniors. They have, I'm sure many have had research positions and they can guide you who to talk to. But I think the best way is to send out masses of emails and see who will reply. Let me tell you, you would not know who's going to help you. It's out of the ordinary. That's why you should send out emails, because you would be surprised who replies your email.
Okay.
Right.
Now we
Right.
have a question from the chat from Hussein. He's asking, can we do researches from sitting in our home country? Or do we have to go abroad to the America?
Yeah. Yes, Hussein, it's a good question. I think this is a very important question. And I think because of COVID and now the advances in technology, we can see how people can do research sitting home. So I have been with 4 students I've met, and I'm writing 8 papers already. What I'm trying to say is that, and I have introduced many other medical students to other physicians who are in the US, and they do online research. So it's a very good option. I think many physicians would be interested. I think you should approach them. And I think they understand, because of the COVID, as long as people are not traveling, it may be a good idea for you to do online and then travel to the US. Online research is very, very important. It can help you a lot.
Okay.
Right.
That's a good answer.
So another question from the chat is that does our internship, like a person has done internship in India, it can be counted in clerkship as well while we're applying for the match? Or the clinical, or I should rephrase it, is the clinical experience in our own country would be of benefit?
The short answer is no. The short answer is no, because they really want you to have US clinical experience. But the long answer may be yes, but when do they start looking at your CV is important. So when you come to them saying that you have done internship in India, that may not be very important. But once you develop a bond with them, you have done some elective or some research, then they start looking at your CV more closer, and all these things can add up and be an advantage. But initially, when you're applying, nobody is looking for that. They really want you to have US clinical experience. But of course, it would not hurt you.
Right, right.
Okay. Okay, now we have a question that how to develop research skills before starting residency so that we get primed up for future research project. Meaning we are in our school year, we have to do the same mass emailing, or how do we work on research skills? What's the basis to go into research? We have to do it ourselves.
Yeah, I think, when I have mentored students in Pakistan, I have met a lot of students, for example, and, you all have the basic skills, but, we just need to furnish those skills and they come with experience. What I would recommend is that, if you are, first of all, how to get a research position, that was a different question and I've answered that. How you find a research project is also, you have to find a mentor and then they tell you what project to do.
Yeah.
But from your end, what you should do is, if you are going to study for example, if you're going to study on a liver lesion or a pancreatic cancer, for example, then you should do your homework, look at all the studies that have been done, do an extensive review of literature, and then tell your mentor that I think this is doable, or I think we should do it differently. So that's one part of the story. Then when you write the paper, you should try to simulate others. How do they write it? Why they use that wording? Why are they not using those wordings? So it's very important to emulate what others have done. If they use one specific language, I think that is very important. You should be using similar language. Don't plagiarize, don't copy paste, but the tone of the language should be similar. So these are the two things that you can do, is read a lot, how they write papers, and then come up and enhance your surgical research by reading a lot of articles.
Okay,
Right,
thank you.
So, sir, my next question would be for the surgery match, general surgery match, that how many years of research, if we get a research position in US, and for how many years of research or number of publications, we would be enough to make a strong case for general surgery match.
Yeah. This again comes down to the fact that I don't think that the number of years or number of publications are the main players of you getting matched. Now, don't get me wrong. If one has 5 publications and the other has 50, there's a huge difference. But the other person has 50 because he may be an older graduate. So then that comes. Are you a fresh graduate or are you an older graduate? A number of years, you can do 1 year, to the fact that you are going to be a research fellow till you match. I think your attitude should be that I'm going to be a research fellow till I match, because they look on those things. They want to see how eager you are. I think, Murtaza, the most important thing again comes down that I think more than the number of publications and more than the year of research is, who are you working for?
Okay.
Right.
Now there's a question about step 3. When do we take step 3? If we don't match, should we go for it? Or yeah, that's the question. Step 3. What would you tell about us? When should we go for step 3?
So I know students who have done step 1 and step 2, and now they're in their country, either doing house job or not doing anything substantial. I think for them, it's very important that they get on to step 3, because indication that you did step 3. Now, please do not fail step 3 now, because I have asked the program director, step 3 significance roughly is going to remain the same. So it is going to remain the same important as it had previously. So it's not going to get any more important than it was. So it's an important test. The scores, if it's very good, can help you, but if you fail, it's going to hurt you really, really bad. So don't do it and then fail it, please. That is my only recommendation to you.
Right.
Okay. Do we have a
So,
question from anyone?
Yeah, I have a question that was previously mentioned. So the question is that if a person has done residency from their own country, like Pakistan or India, so can he, and then he opts for doing USMLE, so can he enter into the US system, and would they, it would be of benefit or not? That
Doing residency in Pakistan, would it help specialization if you do it from Pakistan or any other country?
would he have an advantage or not?
Yeah, again, the short answer would be no. It's that they're not looking for it. They are not looking at residency as a criteria to match you. So
Right.
they're looking at other things which are more important to them. So once they start looking into you, then they will be like, oh, you have done residency, so that would add up as an advantage for you. But initially, when they are screening their applications or looking you up, they would not be that impressed or not concerned about your residency. Because here's the thing, you are applying for residency. So they are assuming you don't know how to operate, you're not a physician. So regardless, they want somebody who's fresh out of medical school and want to be a resident or a physician. So if you have done residency, it's not going to hurt you, but I don't think they take it as that of a significance that you are a trained physician.
Okay.
Right.
Okay. Now we have a question: how much more other fields of surgery, for such as ophthalmology, orthopedics, neurosurgery, are more competitive than general surgery? And do IMGs even have a chance? Should they go for it, or they should go for low competitive spots?
Surgical specialties are very competitive. I know US medical students who have not matched into general surgery. It's very competitive. If you ask me, I did not do well in Step 2 CS. I did not even do well in any of the Step exams. And I think my advice to people who are applying for competitive specialties is that try to have good scores. But if you don't have it, don't give up. Keep trying hard. I know IMG orthopedic surgeons. I know IMG neurosurgeons. It's all possible. But I think it comes down to your willpower and your commitment to the field.
Okay. So, do you have a question?
Okay, let me see.
Check the chat.
So one question is that can you recommend some impactful journals that program directors take in consideration in which we have research? So that is a question from chat box from Mohammad Zishan.
So Zishan, usually what they like is actually the topic you studied. So if you studied, for example, I wrote an article on dog bites, and whenever I went for interview, they started asking me, how do you manage dog bites? It's because I wrote an article on it. So when you write something, make sure you know what the study is all about, because they're going to ask you. Of course, the most impactful journals are, JAMA, Surgery, Annals of Surgery. But I think more often they look at the topic of your study rather than the journal. But if you can get into JACS, JAMA, Annals, Surgery, they're all very good journals, and it will be cited well, and they would definitely be impressed by it.
Right.
Okay, now we have a question that Step 2 CS is cancelled. People used to go to America for observerships, and on the basis of that visa, meaning they got visa for CS and they did observerships on the basis of that. Now, how can they go for doing observerships? Do they use step 3 for this basis or some other way?
Yeah. Now the way to go would be the step 3, and I think the consulates are getting more aware of the fact that students would be requiring visas to the US for step 3 exams.
Right.
Okay.
So we have a question from Mohammad Faizan, also a graduate of KEMU. He's asking that for general surgery match, what scores are required, or is there any cutoff for general surgery match for step 1 and step 2 CK scores?
Usually the programs have a cutoff on their website, but for IMGs, the cutoffs are usually higher. I think if you can score above 250 is a very good score that you can be considered. The higher the score, the better. That goes without saying.
Right, right.
Okay, anyone has a question, they can say it now in the chat box.
There's a question that if a person has 10 publications, but they're not big researches, instead like small case reports compared to 2 or 3 publication, all of them are researches. Which one would look more significant? Big research or more number of small researches?
I think the small number of researches may be better because they may be looking, at the number of pages that are attached to your CV. But usually, I mean, you're asking the question for the sake of it, but I would highly doubt that a medical student, one would have one and the other would have 50. It doesn't happen that much. Usually, a graduating medical student would have one and the other may have 3 or 4 the most. So usually the difference is not much, but yeah, I think the number does play a role. But I think after 4 or 5, they start to look, how come you have so many publications? Maybe you're an older graduate or you're doing research fellowships. If you're a fresh graduate from medical school, I think 1 or 2 are very, very substantial.
So you mean to say that they are looking for research interest, not you must be like highly experienced in research. They're just looking for that you must be interested in research. Am I right, Dr.
Absolutely.
Hassan?
Absolutely.
Right, right, right.
Okay, guys, most of the questions you are asking, we have already covered that. This session is recorded, so you can see that later on. Don't ask those questions. We are not going to take those questions. We have already answered.
Anything, Dr. Hassan, you would like to say to motivate all the aspirants of USMLE and those who are pursuing residency for surgery, especially? So would you like to say anything to motivate them or to just keep in mind?
Yeah. No, I think I would like to tell them that any field is achievable. You just have to know the recommendations and talk to other people to get into those fields. But I think it comes down to you. If you're going to start wondering who's going to sponsor my trip, is he going to be 2 years or 3 years? If you're going to ask which is the easiest specialty to get into, then I don't think those are the right attitudes for very competitive fields, because I know people who have matched into very competitive fields and it's doable. I promise you it's doable. But just because I'm telling you, it doesn't mean anything, because you're still in a place where there is no definitive answer. So I would say don't lose hope. Try to, first things first, get good scores in USMLE, do research for competitive fields. Try not to ask a lot of questions from people who are not in that field, because many of the specialties may have a negative reputation, which may be fair, but it's not that it's negative. It just can demoralize you. And I don't think you want to be demoralized, because I know for a fact that there are IMGs who have matched into very competitive fields, into very big programs. It's all doable. I think it just comes down how much inner strength you have.
Yes, like you, how much dedicated you are to the field.
Mhm.
You have to be persistent enough, right?
Okay.
Get you?
Okay, Dr. Hassan, there is a question that if you have a chance to go for step one before they change it to pass fail, should we go for this course or should we go for the pass fail criteria? Which one would suit our chances?
Who asked this question?
I will see the name.
Okay, whoever asked. So let me ask them. So in theory, both of them are equal. So if you say that I have got 260 step one and the other person has passed step one, according to the rules and regulations, they are both equal. Let me make that clear. Okay. So 260 is equal to pass. Okay.
Okay.
But let me tell you, when you see that application and you see a 260 score and the other person has a pass, the human mind is going to pick the 261. It's just how the human mind works. So my recommendation is, if you think you are going to score very well, go for it. If you think you're not going to score very well and you can get 232 less than that, I would say maybe wait and pass the exam. I mean, no matter what the rules are, 260, 270s, they're very high scores. You have to be a special person to get those scores, even though the program directors are asked that they cannot differentiate. But the human mind, we have all biases that can make the decision for one another.
Okay.
Right.
Okay.
So there is a question from Sachal Suhail, graduate of KEMU. I think you have touched the question, but it is more specific. That is there any field for which graduation years don't matter, or how many years of graduation after which your case becomes too weak?
Graduation year matters for mostly for every field, but it is not the end of the world. That I think what happens is the students get fixated on the year of graduation. I graduated in 2009. I got my diploma in 2010, and I matched in 2013. So there was a 3-year gap. In those 3 years, I was doing research fellowship for 2 years, and then I was getting published. So what you are doing with your time is very important. How old is too old? I really don't know the answer. I think it's very important what you're doing. If you are a resident in your country, that's a good explanation. If you were doing research, it's a good explanation. If you had bad scores and you were trying to compensate it by doing research, those are all good questions. I think one thing we need to understand is the interview. You should be able to defend your answers, and you should be able to cater to the questions and tell them why exactly you are an old graduate.
Right, right, right.
Okay, Dr. Hassan, there is a question that you are a graduate of King Edward Medical University, and King Edward has a lot of alumni in America. So if there are juniors, they can contact them. If someone is from another university and they don't have such a high alumni and they can't contact them, how should they develop contacts?
That is a very excellent question, and actually I was waiting for that question. So, King Edward has a big name. I have gone to many hospitals, and they would say they know only 2 medical schools, Aga Khan and King Edward. So I completely understand what people are saying.
Okay.
But to be honest with you, overall, the name of King Edward per se doesn't help you. For America, you are an international medical graduate. Now, things are definitely different if they know a graduate from King Edward and that graduate was a great surgeon, a great cardiologist, then definitely they're going to vouch for you because they have a reputation. So I totally understand what the question is coming from. But let me tell you, nobody helps or doesn't help someone just because you're not from their school. I have mentored, and I know many people who have mentored people from other schools. I think it's the mindset, how hardworking you are. Don't be shy in telling others. You know, many people don't even know which medical schools you come from, so they're willing to help. That's not a criteria where other people are going to help you or not help you. I understand that there's a lack of knowledge maybe in those schools. So I think for those schools, I think their administration or their students should try to contact people who are willing to give lectures or educate the others in their school so that they don't remain behind. But I think overall, in terms of helpful, I don't think name of the medical school helped me much.
Oh, okay. Okay, there is a question from Dr. Umar. He is also from King Edward Medical University. He is asking that in last year, some people applied on the basis of OET and some people applied on the basis of CS. So they preferred CS, not the OET. Is this going to be the same this year and next year if CS doesn't come back? That's the question. Would OET and CS,
That's
the
a very hard.
comparison will be same?
The comparison would be same, and the programs are asked not to look at CS scores anymore. That's the short answer. But as you know, this is a very complex issue because it has more logistic issues than other questions. But the program directors, to be honest with you, they don't take CS or the OET exam any different. I think the CS exam, majority of the students passed easily. So it was not that important of a test to judge a candidate anyways.
Okay.
Right.
I think if anyone has questions, they should ask now.
I think the questions in the chat are repeating again and again. So my advice for the person listening is that those questions that have been asked, try not to repeat them. So that's why we're not taking questions again and again, because they have been covered in the previous moments. So is there any other question? Yeah, another question is, if a student has slightly less score for general surgery, like 244, should he go for preliminary year or regular match, or what is the importance of prelim, or does it help for getting into prelim?
Yeah. First of all, Umar, I think you are being very modest. 244 is not a less score; it's a very good score. But I understand that if you're saying I got 244, someone got 244, and the other person got 250, sure. So let me tell you, these competitive fields, they work differently. Usually the prelim spot is offered to IMGs because they want to make sure you are a good physician, you can fit in the system, and you can understand the system. So it may be a marker of what they want rather than your scores alone. So I know we try to link everything to the score, but one thing is for sure, if you have very good scores, then smaller community programs, however, usually offer you categorical interviews, and then you can become a categorical resident. The advantage of prelim is usually you go into a bigger program. Like I was a prelim for 2 years in University of Arizona and then stayed there for categorical surgery. So you get a bigger name attached to you than if you were in a smaller program. We can talk about the debate, the difference between them. At the end of the day, you're all trained surgeons. So that's that. So if you have higher scores, the community programs may be more attracted towards you. So your chances of getting a categorical may definitely be higher. But in terms of getting a good fellowship, it has a lot of other factors. More importantly, how published you are, who's your mentor, which residency program were you in?
Right.
I think that's the questions are done for.
Uh,
Are all your
another
questions
another
answered?
another
Okay,
question
okay,
is from Dr. Amar. I think he's asking the question related to just what you said. He's asking that, does accepting a prelim position hurt our chances in the long run in terms of getting a good fellowship?
No, it doesn't hurt you at all.
Right.
Okay. Okay, if someone has question, or we should wrap it up. Okay. I think Dr. Hassan, that's it. We have covered all.
I'm just reading the questions. I see a question from Uttam Lodari. He
Yeah.
says that he did masters in surgery and now registrar in HPB surgery. And if the experience works, I think the experience is definitely, all of you, is going to help you. But for them to look at that experience, you need to be in their system. So you have to somehow get into their system first, elective or research, and then they start looking at all of this. Okay. Same is the answer to internship in India, that it matters, but they want you in the system first. Then I saw there was a question on basic science, question from Caribbean College. All these research is important. Having a line in your CV is much better than not having a line. My first research was that students in King Edward smoke. I wrote an article on the prevalence of smoking, incidence of smoking, and in our school, and it got nowhere. But that's how you start, and even small things help up in getting your CV.
Okay.
And then the number of publications we talked about, and then surgery observerships I talked about, electives we talked about. Yeah, I think we're covered
Everything.
Yeah.
everything.
Yeah, Hussein.
Lecturer and demonstrator, medical college experience, just everything counts. Everything counts, but compared to the US clinical experience, it's relatively low yield, but everything counts.
Right.
Yeah, we got that.
Okay.
Okay. I think
Okay.
that's it, Dr. Hassan.
Thank you so much. I just wanted to thank everyone. There are 43 participants right now, and they have been listening to me for the last 45 minutes. So I commend your, your presence. I really appreciate it. My only message to you would be, make a systematic methodology or how you're going to match. It's very simple. It has its ifs and buts. Bottom line, I know people go to an easier specialty for it may be easier, but I don't think that the easier is only a very, very, very tiny difference. For USMLE and getting residency, you have to be very brave. Nobody's perfect. We all have mistakes. So, everybody can let go of your mistakes also. They're also human beings on the other end. They understand what your limitations are. So don't underestimate that they don't understand what you're going through. They'll understand that. Be humble, be polite, approach others in a way that they want to help you. That is a very important advice I'm giving you, is don't approach others that they don't want to reply to your answers, okay, to your questions. So always approach people in a very nice and a humble manner. You may never know who's going to be your next boss. Study for step 1, step 2, the best of your abilities, the best you can, and then the rest you have no control over. Try to do clinical electives if you can. Do research if you have to. I know as a medical student, I always wanted to do research. Research years were the best years of my life. I gave talks in each and every part of the US as a medical student and a resident just because of my research. So it's a very good experience to be involved in research. So don't take it negatively. Or I know we all want to be residents, but it's not a bad thing to have in your armamentarium. And then I understand not being paid is an issue, but majority of the programs may start paying you once they know you for 4 to 5 months. Again, I wanted to thank the forum, Hamad and Murtaza. Thank you so much for having me.
You're welcome,
And I
sir.
You're welcome.
I really wanted to thank Fernando, who has been up all early in the morning to set this up for me. I really appreciate it. Thank you so much, everyone.